I don't think there's anything that's certain in the world at the moment. There's a lot that can change, there's a lot that can happen. And I think that is in the back of your mind every time I'm going into work.
Adult trauma, ETA 5 minutes.
Got an assault coming in. He's stabbed multiple times.
5-year-old hit by a car, dragged for 3 metres, degloved the right side of their scalp. Code red.
They're now saying partial amputation with a traumatic cardiac arrest.
This is just disastrous.
Travel by cow. I can't make that up.
Oh, it's a proper day today, isn't it?
St George's, London, one of Britain's busiest A&E departments, under more pressure than ever.
What are you doing?
It does sometimes feel like a battlefield, and it feels like a losing battle at times as well.
You need to calm yourself down.
I have 10 traumas and absolutely no space.
25-year-old jump from a 3rd floor balcony.
This is the point where we can make a difference.
Thank you, everybody. Thank you.
A place where life,
Best place to make friends, A&E.
love, and loss
Scariest thing in my life. I thought I lost it.
unfold every single day.
A life is not just a singular thing. Things that happen to you have a huge effect on the people around you as well.
You scare me so much, you know that?
All the patients you're about to see were treated in just one 24-hour period.
I see behaviour every day that reaffirms my belief in the inherent goodness of people.
It's all a bit of a shock, isn't it?
And I think I'm incredibly fortunate to work in that environment.
It's a lot to take in. He's the love of my life.
Is the patient conscious? Sort of. Is he responding in a way that's normal for him?
No, it's a paraglider fallen from height.
It's a paraglider.
Resource, St George's, good afternoon. By air. Yeah, what you bringing? Fine, and injury-wise? Thank you. But 10 minutes away. Yeah. By air? By air. Adult male trauma call, ETA 10 minutes.
A 48-year-old paraglider pilot is being airlifted to St George's after a gust of wind threw him into a cliff.
You need to book his CT, so HEMS by air.
On shift in resus is Registrar Sophie.
A paraglider smashing into a cliff could cause so much damage to the body. They're going to potentially have a head injury, they're going to potentially have spinal injuries, damage to any of their internal organs. You're automatically thinking, OK, I need to raise my game.
Can I please activate the helipad?
The man's wife was on her way to work when the accident happened.
Martin'd left in the morning about 9 o'clock, and I had to go to work that evening. I'm cabin crew for British Airways. So I tried calling Martin, but there was no reply, so I thought, oh, he's just up flying. I was on the crew bus, ready to check in for my flight, and the phone rang with a number I didn't recognise, so I wouldn't normally take it, but something made me take it. Was a gentleman called Paul, and he said, oh, are you Wendy? I said, yes. Oh, he said, Martin's had an accident. He said, I'm with him, but Martin's been very badly injured, and they're going to airlift him to St George's. I just needed to get there as soon as I could.
Martin, we're going to take you in, we're going to get you seen by the team. There's going to be a load of people, OK? You're doing really well. All right, so worst bit ever done with.
So this is Martin. Approximately an hour and a half ago now, he was involved in a paragliding accident. Coming into land, a gust of wind has gone under his chute and basically thrown him into the side of a hill. The injury is identified top to toe. He's got a closed mid-shaft femur on the left. He's got a right hip dislocation and he's had spinal immobilisation maintained.
OK, can we get a primary quickly, please? You're in the hospital. You're at St George's Hospital. OK, I just need you to keep your head nice and still.
Do you have any pain in your chest or abdomen?
My neck hurts.
Need to check your eyes. Pupils reactive bilateral 4 millimeters.
His BP is 93/29.
And what was his blood pressure at scene?
100.
Doctors are concerned about a sudden drop in Martin's blood pressure.
A low blood pressure in trauma patients makes us think they are bleeding quite significantly internally. We need to get them through the scanner, don't we?
Yeah. I'm going to give him a unit of blood as well. I'm not really happy with that blood pressure just yet.
They are potentially going to die if we don't sort that out quickly enough.
Can I please have water urgently to pick up code red blood? Thank you.
Nobody actually witnessed it. We think that just a freak gust of wind came along and Martin had landed into the side of the ridge. I knew it was serious. It could have been the end.
We're going to scan your head, neck, chest and tummy, OK?
Paraglider smashed into it.
48-year-old paraglider pilot Martin is having an emergency CT scan.
And someone was getting the blood ready if we needed it,
If we need it, we're going to get it out, yeah.
Doctors are concerned that a sudden drop in his blood pressure is an indication he's suffered potentially life-changing spinal injuries.
OK, injection going in now.
His wife, Wendy, is travelling to the hospital.
Martin was a risk taker. He got into paragliding because he loved the flexibility of if after work he fancied it, he could just go up to the club and jump off the North Downs. Prior to that, it was free fall, which is where you jump out at 14, 15, 16,000 feet. And you free fall through the air. It was the adrenaline, the endorphins. He always wanted to push himself to the limit. And that's what attracted me to him.
Breathe in and hold your breath.
I think they thought his hip as well.
Martin's childhood was spent at boarding school. He used to go running a lot and play camp in the woods, and he liked his sport. His father was in the army. I think as a child, Martin was just absorbed by that. Ever since he was about 4, he always wanted to be in the parachute regiment. It was an ultimate dream to throw yourself out of an aircraft with a parachute on your back. He joined the 3rd Battalion, the Parachute Regiment. You could tell he was a para, just from his fitness and his whole mental ability.
His head's got a fracture.
Fractured C-spine.
He's got a fractured C-spine.
Severely fractured C-spine.
Yeah.
If you have multiple fractures that cause the spine to be very unstable, then there's a much higher risk that if the patient moves inappropriately or we move the patient inappropriately, that potentially they could end up paralysed.
"30 days have September, April, June and November. All the rest are 31 except for..."
Except for what, though?
April, June and November No, wait. Yeah. April, June and November. No, wait.
I need to get a dress for Rachel's wedding. I've got a bloody deformed thumb for it, for being a bridesmaid.
I shouldn't think anyone knows what the word mugwump actually means.
No. I had heard it.
Yeah.
72-year-old Graham has come to A&E with his wife Diana. He's recently suffered a heart attack and has been put on blood-thinning medication, which may have caused a severe nosebleed.
The Oxford English Dictionary says someone who remains aloof or independent.
I've known Diana since my late 20s.
I thought there were some Sudokus in here somewhere.
I think I was actually engaged to someone else at the time, but that all fell apart, and so eventually I found myself engaged to Diana instead. Oh, you are marvellous, putting up with me here.
Graham. Hi,
was that me? Oh dear.
I had had several rather unsuccessful relationships. I don't know why. I must have attracted some rather odd characters up until then. And I found Graham very fascinating.
So, Graham, tell me about what's been going on with this nose of yours.
Well, the entire history is that I was here after having had a heart attack.
Okay.
So I was in for 2 weeks.
Yeah.
And then just as I thought I was about to get out, I had a nosebleed.
Okay.
It wasn't pleasant. Yes.
You don't feel like there's anything running down the back, you said, no?
No, no, no.
Nice and wide when you're ready. Just say,
I know we had music in common. We both played music which probably mostly predates the 19th century.
You wouldn't mind holding that for me?
No,
You're also my glamorous assistant. Well done.
Oh,
You're thinking of looking inside musical instruments.
Which ones in particular?
Well, all sorts of them, but violins would be very useful. I was also playing for Civil War battles, and Diana was marvellous. She would come along and join in with us, wearing costume. I think that was it. I think we just knew we were destined to carry on from there.
Do you like your head back?
Diana was hoping I might propose to her, probably in Venice, somewhere romantic, on a gondola. But I didn't. I saved it for Penge. We married when I was 30, and then we had the joy of our 3 children.
Can't see an obvious bleeding point at the moment. There's lots of fresh blood there, though.
Okay.
I think I'll just have a quick chat with the ENT. I want to do your blood pressure and things as well, if that's okay.
Okay.
And we'll go from there.
Mr. St. George's. 73 male. Yep, 7 minutes. Okay. Delta Alpha. Thank you.
A 73-year-old man is being rushed to St. George's after collapsing at home.
Adult paramedical ETA 7 minutes.
Paramedics suspect he has severe sepsis, which is attacking his body after undergoing recent chemotherapy.
Sepsis basically causes an inflammatory response in your body, and it can cause end organ damage if it's not treated. Chemotherapy weakens your immune system quite drastically, and you are more likely to deteriorate.
His friend and carer, Des, is travelling with him in the ambulance.
I was looking after Eddie for about 3 or 4 months. And it was just that particular day, his breathing was very, very laboured. I thought, you know what I'm going to do? I'm going to ring 999. The ambulance people could see that his vital signs were deteriorating. When they said he needs to be admitted to A&E, that's when kind of I got flabbergasted.
A lot weaker than he was yesterday. He was able to get up from his bed and he slipped out of his hands and he lowered him to the ground.
And it all started?
Throughout, over the night.
Okay.
Edward has lymphoma cancer, stage 4, undergoing chemo at the moment.
We just pop some monitoring on you, and then we'll pop a gown over you, okay?
Time is very important when it comes to treating sepsis, especially in those who are really unwell. You want to get antibiotics in there quickly. You want to give them IV fluids very quickly.
His BP is dropping.
Gonna need a catheter and another line. It's Sophie in resus. Can I get a portable in resus 4, please? Thanks, babe.
Eddie's blood pressure has continued to drop since he arrived in resus. Doctors have ordered urgent tests to establish the root cause of the problem.
Multiple C-spine, bilateral femurs. He's got nasty neck fracture. We need to bleed him, get a gas off.
48-year-old Martin is in A&E resus after a sudden gust of wind threw his paraglider into a cliff.
Sharp scratch, stay nice and still for me.
My neck is really cramped.
Cramped, yeah, it's going to be sore, so I need you to just keep it nice and still for me, OK?
Doctors are worried he may have sustained a spinal cord injury and are giving him fluids to try and stabilise his blood pressure.
Do you remember what happened?
Crashed.
Yeah, you crashed your paraglider. Do you want me to tell you all your injuries? You have your left scapula, that's your shoulder blade, is broken. Your left hip and both your femurs, that's the thigh bone. OK? You got some fractures in your neck, quite a few, in the top of your spine at the back, which the neurosurgeons are looking at. We're giving you some pain relief at the moment.
You just have to stay really still.
If someone has multiple injuries, particularly both their legs, their pelvis, multiple injuries in their spine, we do worry how they're going to manage later on in life. This patient might never be the same again.
Martin's wife, Wendy, has arrived from London Heathrow.
Hello, Poppy. Hello. You all right?
I'm sorry.
Oh, what are you like? In pain? Have they told you where everything's broken? Yeah. You're going to be all right, aren't you?
I'll always be right for you, Wendy.
We met in 2001. A friend of mine invited me to a fancy dress party. And it was schoolboys and schoolgirls. And there were a few boys dressed as schoolgirls, of which Martin was one of them. And he had a long blonde wig on, high heels, short skirt, black bra. I just liked his cheekiness and his sense of fun.
Don't move your head. Try not to move your head.
Oh, beautiful.
So this blanket is just going up again.
Thank you.
This will just
That's my erection.
warm you up.
Tell he's ex-army, can't you?
I think when you get to your mid-30s, you kind of know whether he's the one. And we were very well matched. He was very much live each day as it comes, don't take anything seriously. He moved in a year after we met, and then we got married a year after that.
You too.
When you meet that lifelong partner, you would go through anything together.
Doctors have reviewed Martin's CT scans and now understand the full extent of his injuries.
So yeah, look, he's done both, and he's done his left neck of femur and both shafts. But his neck's bad. His neck's. So he's chipped that there. He's chipped that there. He's chipped that there. But then he's also gone through all the spinous processes. Injuries to the spine and the neck can cause some of the most devastating injuries because ultimately patients can be paralysed. The higher up in the spine that injury, the worse the level of paralysis. But it's going to be unstable.
With so many unstable spinal fractures, Martin will need to be assessed by orthopaedic and neurosurgeons who will plan the next stages of his treatment.
Are you? Where? Everywhere? Where? Keep your neck still.
I think I'm definitely the stronger one. But when you think he's never going to be able to walk, it's hard to stay positive. You know, he's very badly injured.
Can I have a go? Yes, we've lost its tail. Don't think it'll help me at all. Oh, that's not bad, actually.
Quite good.
It's not so bad. Oh, thank you, sir. Oh, that... You broke my arm.
Edward, when you take penicillin, what happens? Do you have a rash or you get a rash?
It's been 16 minutes since Eddie was brought to A&E with a severe infection following his recent chemotherapy. Doctors are trying to stabilise his low blood pressure with antibiotics and fluids.
Put yourself forward if you can.
His friend and carer, Des, has been waiting in the relatives' room.
Edward, I'm just going to give you some antibiotics. I'm sorry.
Good, Your Grace, thank you. Where are you from?
Ireland.
So are we. Eddie and I have been friends for over 40 years. Both Eddie and I grew up in Dublin. I know Eddie more or less had the same kind of lifestyle as I did, going around, doing things on his bike. He was a fanatical footballer. He was a referee and reffing for the Football Association of Ireland. We'd kind of meet up in town after college. We'd go and have a couple of drinks. Eddie's sense of humour. It was just kind of typical Dublin, quick-witted, quite sarcastic, which is good. We just became good friends.
Edward, in order to get a control of your blood pressure, we need to give you some more fluids and some drugs. So I need to put a new line in your neck.
Okay.
We'll start getting all of that stuff ready now.
Okay.
Despite being given antibiotics and fluids, Eddie's blood pressure has remained at a dangerously low level.
And I'll call you back, OK? Thank you.
He now needs a central line inserted into the main vein in his neck, so doctors can administer a drug called noradrenaline.
How are you doing with the blood pressure?
60/32.
My main reason for moving to the UK was the job opportunities. Eddie came across about 4 years after, which I think would have been about the early 80s. The troubles were going on in the north at the time, and we as Southerners we didn't know too much about what was going on and what kind of reception we would get over here.
That's right, we're ready to go.
The worry was that there would be racism. There used to be an expression on B&Bs, no blacks, no dogs, and no Irish. There were always nagging fears about the Birmingham Six and the Guildford Four, and you know that maybe justice was not so blind. And that was a major fear with Irish people.
Eddie, can you turn your head to the left for me? Is it perfect?
Just going to lie you a bit more flat just until we get this done, OK?
Okay, dear.
You OK?
But as it turned out, we couldn't be treated any better. Eddie made a community of friends. And your quality of life is really based around who you have as friends.
OK, Eddie, that injection's coming up now, OK? Just a bit of local anaesthetic.
Yeah.
Doing really well. I know, this is the most uncomfortable part. Central line's going in.
When doctors have inserted the line, they'll be able to administer the drug to try to raise his blood pressure.
It's a love thing. It's a love.
We went to Asda last night, right? And they're playing some tunes in there, right? So
she was dancing.
I was dancing, I was singing, and this man's walked past and he's gone, yeah.
Just relax for me.
72-year-old Graham has come to St George's with a severe nosebleed following a recent heart attack. Nurse practitioner Becky needs to carry out tests to ensure his medication isn't making his blood too thin, as it could lead to more serious medical issues.
Have you had any blood tests done today?
No.
No.
The reason for that is that nurses don't seem to be very good at finding veins.
Oh, you're one of them.
I'm afraid I'm one of them.
I'll send an expert.
Yes, that's right. The very best you've got. Taking your leg off.
Graham's always enjoyed music ever since I've known him. He's always been playing something all the time.
I need to get some bloods on this lovely man on the ENT room.
Neither of my parents played any musical instrument. My father was in the Royal Engineers as a bomb disposal officer. He was a very meticulous man, and I tried my best to emulate him.
You've asked for the best. I've brought you the best.
Oh!
This is Jenna.
That's good.
If Jenna can't get blood out of you, then no one is going to be able to.
I was just looking at my... and there's not a vein to be seen. I wasn't terribly academic. I left school with no A-levels. I had no idea that the music was eventually going to play such a dominant role in my life. There was a job going at Sotheby's as an administrator, and I can't imagine what competition I was up against, but miraculously I got the job. I started in 1969 administrating a department which included any musical instruments that turned up. And my then boss said, well, Graham, you're the one who's interested in musical instruments. Why don't you look after this? And indeed, that was it. I suddenly found myself actually running this department within 1 year. I couldn't believe it. I simply couldn't believe it. In my early career at Sotheby's, I was away a great deal. I travelled abroad 1 in every 2 weeks. So poor Diana had the task of looking after the children. Okay? Good. Did a great job.
Winner,
no
winner.
bother, you were quite right.
See?
Take a couple of deep breaths for me. Just in through your nose and out through your mouth again.
Martin's had a paragliding accident. He's all right, he's conscious, but he's got quite a lot of breaks. So, well, he's got a couple in his neck, shoulder blade, his hip, and both of his legs at the top. It's not good.
Right, we're going to change his collar over. She's going to give you a bit more morphine as well.
CT scans have revealed Martin has suffered multiple breaks to his spine. He must now be fitted with a secure neck collar to prevent any further injury.
Right, you got to stay nice and still for us, OK?
It's absolutely horrific. He's got broken vertebrae. Neurosurgeon wants to see him as well.
I'm just going to wet your laps, OK?
No.
Where are you from?
Just above Dublin.
Oh,
We're going to get you some more pain relief, OK?
you're a star.
A lot of ex-parachute regiment are members of paragliding clubs. And I think once it's in you, that kind of thrill never really goes away.
You're there.
Yeah.
I love you so much.
I love you too, Poppy. When you've been in the military and you push yourself to the limit, where do you stop? You keep pushing yourself. You just want to find that extra thrill, and replicate what you had before.
Are you right-handed or left-handed?
I'm left-handed.
Left-handed. And do you have any illnesses?
If I run, I'm very, very fit.
It was terrifying, but I kind of over the years have got used to that. I wouldn't stop Martin doing whatever he wanted to do. Even though you might be 30 years old, it doesn't go. It's always there. And I think that's what Martin had. And he always wanted to push himself to the limit. Because I suppose it reminds you that you are still alive and you can do it.
Right. Neurosurgeon David has come to assess Martin's spinal fracture.
The reason I've come to see you is because you've broken your back. And looking at the fractures, you probably did that with your neck. The ligament, it looks like they've broken and then they've pulled off the bits of bone with them. And they've done it all the way through your neck, so it's quite serious injuries. If you were to move around, you could damage the nerves until we've got the proper brace and the collar on.
Adrenaline.
73-year-old Eddie has been given noradrenaline through the main vein in his neck in an attempt to raise his dangerously low blood pressure.
When did you have your last chemotherapy?
On Friday last, not yesterday, but the previous Friday.
In St. George's?
Here, yeah, in Trevor Howell ward, day ward. He believed that he had a hernia, and he had been booked in actually to have an operation to have the hernia fixed. The surgeon basically said, I don't think this is a hernia. You need to have more tests done. Take the mask off. I can only take it off for a second. The final diagnosis was that he had stage 4 non-Hodgkin's lymphoma. And the tumours were all over. And from that point on, they put him straight onto chemo. And that's when it kind of hit like a sledgehammer. Breathe in deeply, Eddie. If you can, breathe in deeply. Cover up. It was very, very difficult for him to talk about. It was even more difficult for me to hear it. And suddenly think, God, what does this mean? For my best friend, how long had he got? You're so helpless, so incapable of doing anything. And, you suddenly kind of feel, God, what's going to happen?
His BP is dropping to 60. So BP is 55/36.
Despite being given the medication, Eddie's blood pressure has suddenly dropped even further.
Ed, how you feeling?
If your blood pressure's low in the context of sepsis, then you're worried that you're not providing enough blood supply to the rest of your body. If you're not providing enough oxygen to your organs, you then start developing multi-organ failures.
So we started that about 5 minutes ago.
Yeah.
Can you go up to 0.2?
All agreed?
Yeah.
Doctors urgently need to increase the dose of noradrenaline before his body and organs shut down.
Where did we come from? This way. Don't you think someone deserves a cuddle?
Can I have my torch back, please? No. You don't think that smell will get you everywhere in life? It will. It will.
It's like working in a supermarket in here, isn't it? With all the bing, bing, bing.
48-year-old Martin was airlifted to A&E 4 hours ago after his paraglider crashed into a cliff.
So much safer.
So what?
So much safer with you.
Oh.
Since meeting Martin, we've tried numerous sports. We've done mountain running in the German Alps. Martin's run a few marathons. Yeah, we're very active. I believe that if he couldn't be active anymore, he would find something that would make his mind active. He wouldn't just sit there feeling sorry for himself.
Some water.
I could be a nurse for you.
Just because you want them to get better doesn't mean they will get better. I don't think I did realise how serious it was. I just seemed to think that the doctors were there, they would mend him. Very naive, really.
Orthopaedic consultant Amir has come to discuss the next stages of Martin's treatment.
So, most important tonight is the fact that you've broken both of your legs.
Biggies.
The big ones. You've also broken some bones in your neck.
Yeah.
So what I'm going to do is stabilize your femurs for you. The other important thing to say, this is potentially life-changing for you, okay? I'm not going to lie about that.
What do you mean?
These are serious injuries, and it's possible you might not get back to the level of activity you're used to, all right? But we will talk about that at another time.
Thank you for your honesty.
I'm going to go away and plan for your surgery upstairs.
Thank you so
These guys
much.
are going to look after you until then.
Thank you so much.
Okay, is there anything I can answer for you now?
No, I don't think so. I think you've covered everything. Thank you.
I'll look after you, don't you
so much.
worry.
God bless you.
Thank you. Thank you very much.
You see patients that are the most seriously ill that they have been in their life and potentially on death's door. And you see their relative dealing with that emotion. You see the patients dealing with the realisation that they might not make it out of this. And ultimately, the thing that shines through most of that is love for the ones that they care for and the ones that care for them.
Martin will have immediate surgery to stabilise the fractures to his legs. He will then receive treatment for the breaks in his spine before doctors are able to determine whether he'll be able to walk again.
Wild animal beginning with H.
Hyena?
Oh, yes, and that would explain... Ah.
Graham is waiting for his test results to see if his heart medication has caused his blood to be too thin.
Feel okay?
Well, it's very blocked.
Ah. As you get older, relationships seem to develop strangely in a kind of warmer sort of way. There was a kind of change in the relationship when our 3 children were growing up because it's such a busy time. Once the children were beginning to move away from home, I think that meant we could think about each other more and not have to worry quite so much about them. How to act like a servant. 3 words.
Servile?
We have a sort of companionship which is very supportive. So I think we're just both very lucky that we found each other.
Sorry for the delay.
That's all right.
Right. So your blood tests have come back and your platelets and things are a good range. So I think we can risk disturbing this little blood clot.
Good.
I'll look after you, don't worry.
Graham's blood tests are normal, but now Becky needs to remove the clots inside his nose to prevent any further bleeding.
Really? All up close and personal.
Yes, it is, isn't it?
We're not pinning you down.
Strapping me down.
It's like a constant. have taken some of the clots away.
I presumably got to try and avoid being tempted to blow my nose.
Yeah,
or...
exactly. I'm going to give you some cream to pop up there twice a day for 2 weeks. Take it easy. Don't do things that are going to kind of raise your blood pressure too much.
No, I shan't. So, I don't suppose Diana will let me.
Well, you've
running
been
around.
taking things very easy.
I've been taking it very easy. I have absolutely no doubt that in my case, the most important thing in life is my marriage to Diana. I could live without musical instruments. I could do something else if I had to. But I couldn't think of doing it without Diana. Thanks so much.
That's okay. Well, I didn't really do too much.
You
in the
did
end.
quite a lot, I can tell you.
Could I employ you as my left-hand door opener? Thank you.
I'm just going to bring you over like that. Is that okay?
Yeah, great. Thanks, Laura.
Doctors have managed to stabilise Eddie's blood pressure. He'll be taken to intensive care, where specialist doctors will observe him closely.
What happened to me before? What happened to you? The blood pressure isn't doing too great at the moment. Before he was diagnosed with cancer, I was working as a freelance IT professional. When somebody's really sick, it concentrates your mind on what matters most to you. Isn't work, isn't anything else. It's not your own health. It's just that person that's sick on that bed. And how are we going to get you better? So I decided to look after him. Lifelong friends are few and far between.
You okay? You sure? Can I get you anything?
We've been friends for 40 years.
40, my goodness.
And like my emotions are going like that.
Yeah, you need to stop watching that as well.
The bed is ready for him, Scars.
Okay, cool.
Oh, fantastic. The bed's ready for you upstairs.
I think one thing ED has taught me is that life is so precious. You need to appreciate all the time that you do have. And you have no idea what can happen to you.
You need a hand.
Des, he's really been my best friend, and if anybody has even half the goodness of the relationship I've had with Des, they've been very, very lucky people.
He had the first operation and then was taken straight to the neuro-intensive care unit, where he was put in a coma and he was intubated and was on a feeding tube. Inside, I was very scared. I don't think you'd be human if you weren't scared. As far as all the consultants, the neuro consultants and the orthopaedic consultants are concerned, He's a miracle.
The parachute regiment teaches you to sort of feel pretty indestructible, but you have an accident like I did, and you realise you're not. When you come close to death like that, after that every day is joyous. Nothing can get you down because you've survived that encounter. It has definitely made me treasure my relationship with Wendy. She means the world to me. She really does.
NHS. Who doesn't say H?
The NHS.
It's my Australianism, mate.
St George's recess.
My heart just sunk. Is he ever going to walk again?
It's like a shiver just goes down your spine. What sounded like shin pads clashing was his bone snapping.
Thank you.